Hey, welcome everyone. So we have simultaneous ASL and Spanish interpretation today. So before we begin, I'm going to pass it to our Spanish interpreter for instructions on setting up your language preferences today.
Thank you, Emily. And hi, everyone. This is Andrea, and I am here with my co-interpreter, Annabelle, and today we will be the interpreters between Spanish and English. And I'm going to give you some instructions so that you can select your language channel and you're able to listen to us in Spanish if that's what you want. And I will be giving these instructions also in English, as you can see, and in Spanish. And also, this is a friendly reminder that there will be American Sign Language interpretation, and we have two interpreters in the room as well, and you will see them on display on the screen at all times. Okay, so for now, if you're an English speaker, we ask that you also choose English as your language of choice. And to do this on your computer at this time, you should be able to see a globe icon that says interpretation. It's usually on the bottom of the screen. So please go ahead and click there and then select English, and do not mute original audio. Just select English and click done. This should be and this should make it possible for you to listen everything coming from the main room. Okay, and now I'm gonna switch to Spanish to let everybody know how to select their language channel. Así que hola, bienvenidos a todos a esta sesión el día de hoy. Yo soy Andrea, estoy con mi cointérprete Anabel. Vamos a ser las intérpretes entre inglés y español. En la sesión también habrá disponible interpretación en el lenguaje de señas estadounidense, para lo cual también hay dos intérpretes en esta sesión y estarán constantemente en la pantalla para poder ellas interpretar. Bien, para poder escuchar en español, lo que deben de hacer en este momento es seleccionar el icono de interpretación que aparece en la parte inferior de su pantalla. Después seleccionen español. Por favor, no silencien el audio original a menos de que deseen solamente escuchar al intérprete. Si están en un dispositivo inteligente como su teléfono o tableta, pueden también, por favor, seleccionar interpretación al tocar ligeramente la pantalla para ver el menú de 3 puntos que dice More. Después ahí verán interpretación. Después seleccionen español. De nuevo, si solamente desea escuchar al intérprete, silencie el audio original y para activar la selección, presione listo o done. Si está en una computadora Chromebook o está llamando por teléfono, no tendrá acceso a esta configuración. Muy bien, ya todo el mundo debe de estar ahora en un canal de idiomas y podrán escucharnos. Entonces voy a pasarle de vuelta la palabra a Emily. Muchas gracias. Okay, back to you, Emily.
Thank you. Okay, next slide, please. So I'm Emily Finley, Program Coordinator for Community Campus Partnerships for Health, or CCPH. Thank you for attending our first Lunch and Learn event on participatory budgeting, a health equity approach. I'm going to present an overview of participatory budgeting for health equity, and then we will hear from a really exciting panel of speakers. So first, I want to introduce CCPH. We are celebrating our 25th anniversary this year, and our mission is to promote health equity and social justice through partnerships between communities and academic institutions. Next slide, please. Our strategic pillars are the leading activities we engage in to promote health equity: leading, convening, disseminating, partnering, and training. CCPH is currently a partner on several large-scale federally funded research initiatives related to COVID, long COVID, and community engagement, among others. Next slide, please. So please take a moment to answer the poll question appearing on your screen. How familiar are you with participatory budgeting? We just want to get a sense from the folks in the room of how familiar you are with this concept today. Is this something completely new? Is this something that you're kind of familiar with, very familiar with? Great, I see some responses coming in. Thank you. So it looks like we have responses kind of across the board here. A lot of people are somewhat familiar, somewhat unfamiliar, very unfamiliar. Okay, great. Looks like we can. Great, so those are those results. So we're kind of all across the board here, but it looks like a lot of people are curious to know more about this. So let's go to the next slide, please. So we would love to know more about who is joining us today. Take a moment to put your name, pronouns, and organization in the chat. And if you'd like to share with us one thing that you're looking forward to this summer. And I'll share that I'm looking forward to celebrating my brother's 40th birthday in August this year. Okay. And let's see. Yeah, so please feel free to introduce yourself in the chat. So while you're doing that, we will go to the next slide and go over some key terms. So I want to introduce some key concepts that we're going to be exploring throughout the webinar. So the first one, of course, is participatory budgeting. So that is a democratic process in which community members decide how to spend part of a public budget. And participatory budgeting, or PB, is a strategy for creating fair, equitable compensation structures that directly benefit local communities. Now, the public budget could be a municipal budget, or it could be something like a budget from a funder to fund special projects. And we'll be exploring today how participatory budgeting can be used to promote health equity in communities. So put simply, health equity is the state in which everyone has a fair and just opportunity to obtain their highest level of health. So the opposite of that is a health inequity, where different groups of people experience differences in the conditions, opportunities, and resources needed to attain health. Next slide, please. So one more key term to tie it together, social determinants of health are the conditions in the environments where people are born, live, learn, work, play, and worship that affect a wide range of health, functioning, and quality of life outcomes and risks. So the graphic on the left shows the 5 main domains or areas of social determinants of health, which are economic stability, education access and quality, healthcare access and quality, neighborhood and built environment, and social and community context. And that can relate to things like discrimination or community belongingness. Social determinants of health can determine the level of health equity or inequity in a given community. So participatory budgeting, democratically deciding how our money gets spent, can be used to address these social determinants of health, where we live, where we learn, where we work, where we play, by putting forward funding initiatives that directly impact health and wellness. Okay, next slide, please. So, go back one slide, please. Great, thank you. So participatory budgeting was originally developed in Brazil in 1989 by grassroots social movements who were fighting against corruption and calling for more transparency in the government. And since then, it's spread to over 7,000 cities around the world and is recognized by the United Nations as a best practice of democratic governance. So while all participatory budgeting processes are different, this slide shows the typical cycle in 5 steps. So first, this is to design the process. And typically a steering committee or advisory board that represents a community group will create rules and engagement to guide the budgeting process. And the next step is that community members brainstorm and discuss ideas for projects through virtual or in-person meetings. Those ideas are then developed into feasible funding proposals. Next, the proposals are presented back to the community, who then vote on which proposals best serve their needs. And then finally, the winning projects receive funding to be carried out in those communities. Next slide, please. So there are a number of benefits to participatory budgeting for health equity. One is that it empowers community members who are most impacted by health disparities. Often people most impacted by disparities are left out of the conversation. They may be left out of power structures. And so the issues that most impact them may not be addressed. But participatory budgeting can also result in programs and services that are culturally appropriate and relevant to communities. They help identify overlooked or neglected community needs. It also values lived experience and community voice as actionable data. So that means that in participatory budgeting, community members get to share their lived experiences and their perspectives, and that information is acted upon, right, as something that could be put in a funding proposal. Participatory budgeting increases power sharing among community members, institutions, and funders, and it promotes collaboration and partnership among all these multiple stakeholders and sectors. So it really is a collaborative, community-driven effort, and that results in funding for projects that are really needed in the community and empower people living in those communities. Next slide, please. So participatory budgeting can be used to increase health equity because it addresses these social determinants of health. All these places are schools. It can address things like built environment. Do you have parks in your neighborhood? Things like clean air, clean water. These are all things that can be addressed through these processes. It also distributes funding and resources where it's most needed, and it builds capacity to address health inequities at the local level. So a lot of that capacity comes through partnerships that are built and sustained, and community leaders that are grown through these participatory budgeting processes. Next slide, please. So some recommendations for success if you are engaging in a participatory budgeting process, and I'm sure our panelists will have more to say for this, but some top recommendations are to build infrastructure that supports community engagement and outreach, executive leadership, program administration, and other full-time staff. Making sure that you have the infrastructure that you need to support participatory budgeting process from beginning to end. Another recommendation is to limit restrictions on the types of projects allowed, making sure that you know, a variety of community-based organizations and members can be involved and have their ideas heard. Ensure that voting processes are transparent and inclusive of traditionally underrepresented populations. This might mean ensuring that you offer services in different languages or materials in different languages, making sure that spaces are accessible to people with disabilities, things like that. Provide appropriate compensation to participants and CBO partners who participate in things like steering committees or committees to put proposals together. Be upfront about the strengths and limitations of participatory budgeting. You know, making sure that it's well understood that participatory budgeting can have a lot of advantages, but it can't solve everything. And so just level setting those expectations in the community so that people are not set up for disappointment. And finally, providing administrative capacity building and training opportunities for community-based partner organizations and also for grantees to make sure that once projects receive the go-ahead for funding, that they can actually have the capacity and infrastructure to implement that funding. So next slide, please. So this is an example of an active participatory budgeting process that's currently taking place in Providence, Rhode Island. It's called the 9 Neighborhood Fund, and it's driven by a coalition of over 60 community organizations, government entities, schools, service organizations, and other stakeholders. Community members in designated zip codes will vote on community developed project proposals to use $1 million in public health funds. So the graphic on the right is a screenshot from their website that shows examples of the actual proposed projects. So that includes a community kitchen, lead-free water project, air filtration project, peer mental health training, community pool access. And so looking at these projects, you can see that they all connect to social determinants of health in some way or another. They're aiming to make changes to the environments where people live, work, and play. And so this is really exciting to see that this process is actually you know, happening now here in the US. And that there will be real results from this. And we actually are including in our packet of materials for participants the guidebook that the 9 Neighborhood Fund developed for their participatory budgeting process. It's a really fantastic guide that shows you how to apply these concepts in a real community. So very exciting to have that. Next slide, please. So before we hear from our panelists, we're going to play a short 4-minute video called Real Money, Real Power, Participatory Budgeting that was produced by the Participatory Budgeting Project. So we can play the video. We're not getting sound from the video. That's better, thank you.
Right, if you live in this community and you pay taxes, come out and vote, decide how your tax dollars get spent.
Participatory budgeting gives people real power over real money to make the decisions that affect their lives. It's a democratic process in which ordinary community members directly decide how to spend part of the public budget.
Oh, this is different because you're actually voting for where the money is going to be spent instead of allowing them to decide where to spend the money.
Who knows better about their community than the people that live in their community?
Not be afraid of the big words, participatory budgeting. It sounds boring, but it's the opposite of that.
So how does it work? First, people brainstorm ideas. They come together in meetings and assemblies and start to think of what kinds of projects they would like to see in their neighborhood.
We had to think big. We have $1 million that we could use, so we can fund parks, health issues, streets.
Volunteers work with experts to turn people's initial ideas into full project proposals.
We started with maybe about 40 projects, and so we had a series of budget delegate meetings, and we narrowed down the list into about 4 or 5 projects.
We met with the Parks Department and we talked about what we wanted to see change in some of the parks and how we were going to work with them.
What are the real needs of the community? If you only have a certain amount of money, what is it that you can do that's going to benefit as many people as possible?
I'm dreaming of new benches, modern benches. Seniors have nowhere to go.
Displays at bus shelters throughout the district, and it will tell people when the next bus is due to arrive.
We're asking for a projector and 30 Mac laptops.
State-of-the-art teen fitness center.
To put solar panels on a firehouse.
After volunteers share the top projects, the community gets ready to vote.
It's a way of validating every voice in our community and saying, you know what, whatever your position is, you live in our community, you have a right to decide. And that me as a representative and government should respond and should listen to that voice. Anybody could vote in this process, immigrants, whether you're documented or not, young people that normally don't get to vote.
Most people, they don't even know that CEOs can come out here and vote today. Some of them are really surprised. They said, really? I said, yes. They have a voice.
The projects with the most votes get funded.
The Red Hook Library Community Garden, right here.
The projects are then implemented over the next few years. And the following year, the process starts again. People brainstorm new ideas, turn them into new projects, vote on them, and fund more improvements for their community. PB becomes part of the budget process. It becomes a new way of governing.
I think this is like the greatest wave of democracy coming into the United States. It started in Porto Alegre, Brazil in 1989.
From there, it spread all over Latin America to over 1,500 cities around the world. In Toronto, public housing tenants have decided how to spend millions of dollars on improvements to their buildings. City council members in Chicago, New York, and other cities have engaged thousands of residents in allocating discretionary funds. Entire cities have launched PB, such as in Vallejo, California, for funds from a sales tax, and in Boston for youth funds. Even schools and universities have used PB.
This was a great opportunity for you to be a part of government and better the city you live in. Who wouldn't want to take advantage of that?
You're creating a more educated platform of voters overall. So I think this can only be good for the big project of democracy.
Okay, thank you so much for showing the video. So now that we've seen some examples of real participatory budgeting processes, we'd love to hear from you in the chat about what kinds of services or infrastructure would you like to see funded in your community? What do you think would make a difference? Oh, public transit. Someone said yes. Very important. I'm actually based in Philadelphia, and we had a highway collapse. I-95 collapsed, which is a huge highway route. And now there's more interest in building a subway line that connects that area. And people are saying we need more public transit. I'm seeing farmers markets, community gardens, yes, community health clinic, mental health emergency responders, very important, accessible health information and services, sidewalks, community health workers to support prenatal and postnatal health, community response to climate change. Yeah, these are all fantastic ideas. So with that, we can go to the next slide. So I'd like to introduce our panel of experts who will chat with us for the next 30 minutes or so. We'll have some guided questions first, and then we'll open it to the audience for Q&A. So please do feel free to use the chat box to share your comments and reactions and questions. Today, we're joined by Paige Castro-Reyes, Deputy Director of CCPH. Paige has been with CCPH since 2013, serving as project coordinator for multiple multi-partner projects focused on community engagement, ethics of research, and culturally responsive research practices. We're also joined by Angelica Delgado Rendon, who has experience teaching community research, program evaluation, entertainment education, and clinical diagnostics. Dr. Delgado Rendon serves as instructor at the Medical College of Wisconsin and has worked on an extensive array of health areas and is particularly interested in studying empathy and advancing Hispanics in medical education. Finally, Misha Nguyen is the founder and executive director of Project Momentum, Inc., a 17-year-old community-based organization located in Rocky Mount, North Carolina. She has served as a consultant and co-principal investigator on multiple community engaged projects and uses her 16 years of expertise in community engagement, community-based participatory research, and program coordination to leverage assets for communities through research. So wonderful. Thank you so much for joining us. I think we can maybe pull down the slides and just spotlight our speakers. If that works for folks. And then we'll just have a conversation here. So my first question for the panelists, and we can really go in any order, is how does participatory budgeting support health equity in general? And I can call someone to start, or someone can start. And also, if our speakers have anything you want to add to introduce yourself, please feel free to do that.
Yeah, well, I can go ahead and start in terms of the first question. I'm honored to be on this panel with some new and old colleagues here. So the question, how does participatory budgeting support health equity in general? The root of health equity is really about the unequal distribution of resources made available to us as communities, as people, you know, navigating our lives here in the areas that we live and the communities that we are a part of. And participatory budgeting is really, it's a big deal because that is actually looking at a resource distribution. And when you're in a partnership, when you're, you know, the example that you provided beforehand, looking at distribution of community, of city resources, of grants provided to the city across the community, you know, that's a real big example of equitably distributing resources to programs that matter to the community, that they say this is of value and we need help and support and resources here. But then in a partnership, it's a really interesting process, sometimes uncomfortable for people to, when you're working in partnership, you have to acknowledge some power differentials, some resource differentials, and participatory budgeting is a process that just works to mitigate at those existing facts of the unequal distribution of resources. So as someone that's been on the nonprofit to institution side to national nonprofit with grassroots communities, there's a lot of conversations that need to be had and understanding and creating space for everybody to say, this is what I'm working with and this is what I need. And it builds trust. It builds a real honest partnership that and rapport. And I think it really sets a tone for the work that you're doing. And again, back to the question, health equity is about resources. So it's probably the most direct thing that you can do in a partnership or in a community.
Thank you, Paige.
So I totally agree with Paige. The one thing that, and I don't think you left it out intentionally, Paige, but I think all of this starts with the word trust and building that transparency and that trust between the community and whomever they are going to be engaging with in order to, be able to mitigate some of those health disparities that we're often often plagued with. We have to begin to trust that we're all coming together for the same common good. And I feel like if we're able to get to that point, then we can begin to knock down those other barriers that Paige talked about. Then we can begin to have those direct conversations where there are no hidden agendas on the table, which will help us reach that health equity. I feel like for so long, we have been in a space where we'll come to the table unclear about everyone's motives, which essentially keeps everyone sort of kind of on edge and not being as transparent and honest as they could potentially be. And I feel like if we can just bare our souls with one another, then we'll be able to get to this place where we can truly fight health disparities as a collective and instead of being individuals or being siloed.
Yeah, thank you for that. Trust and transparency is really key to all of these community-based processes. I would love to hear from you, Dr. Rendon.
Hi, everybody. Well, first I want to say that I agree with Paige, what Paige has mentioned, and she brings up a good point that she says it's kind of an uncomfortable conversation to have, like that means at the level of individual partnerships. And I think that is very important to know that it's an uncomfortable situation because we've never had the chance to do it before, or it's never been really a part of like the structural dynamics of a democracy and sharing power across different communities and different types of companies. And so this highlights a very good point that you mentioned. I mean, in the video they talk about how this began in more formally in Brazil in the 1980s. But I realized that I was doing it, and I was doing it partly with Dr. Alan Wells, who's here in the 2000s. That's when community research began to take off in the United States, as I recall. And so it just seemed like the natural way to go about creating change, creating social change. You cannot, I don't feel like you can create social change without actually sharing some of the resources available with planning, and maybe we can talk more about that in the follow-up question. But I do think also that it needs to be from all the levels in society. I just found out that actually Wisconsin, apparently we have a surplus of money.
Oh.
And they want to cut taxes. They want to cut it back. It's like, no, we should figure out what to do with that money.
Right.
Like, this seems to be the right way to go about things, because I think there are a lot of issues that we can tackle, as we saw in the video. And if we could vote on it, but we are not allowed to. We cannot vote on it. That only is done by the Congress, and so they're making other decisions. And so I do feel it's very important from a partnership, like one-on-one partnership level, up to the larger systemic level.
Thank you. So we have a question in the chat from a couple attendees. Do you have experience using participatory budgeting in a research context? This is a really important question. And this person is saying, how would a faculty member who is wanting to apply for an NIH grant use participatory budgeting? So Paige, I can turn it over to you, and then we can also get responses from the other panelists.
Yeah, certainly. So I'm actually actively in the process of doing participatory budgeting for multiple community engaged research projects. Some of them are new, some of them are re-upping, renewing, hopefully for another year. And in those conversations, I feel like in my 10 years of being at CCPH, we've shifted just from like $20 gift cards to really looking at, okay, these community members are going to be on these meetings monthly. We need some recurring payments happening. We need to build an infrastructure for that. What does it look like for CCPH as a community-based organization or a nonprofit to have funds and support to support all of the fund distribution? So for us, we've had to think more holistically about what the actual cost is of some of these activities, and starting with what is respectable compensation for community partners, what are ways that we can use our funds available, our other direct costs that can eliminate some barriers. CCPH has distributed hundreds of thousands of dollars in community grants that are, at the beginning of the pandemic, we need PPE, we need hand sanitizer, we need support to keep the lights on in this building that you want us to distribute our COVID test kits out of. There's things like that. But then as far as us being a nonprofit, for us to distribute those funds, we need additional hours for our accountants. We need additional hours for the administration staff that's supporting that, because unlike an institution that has probably higher federally negotiated indirect rate, we can't absorb a lot of these things. And so that's where the direct line items come into play. And that's where you all as researchers have to really fight for those things for us and saying, this is a justified cost. This is a justified cost. And acknowledging again, those conversations around this is our infrastructure, and in order to meet the needs of this scope of work, this is the support that we need. If we're not able to get that financial support, we have to reduce our scope of work. So kind of addressing what the expectations are, what the costs associated with those expectations are, and trying to meet in a way that we're not, that the community organization, they're not being run out and in an unsustainable way at the end of the project. Yeah, I think Misha, you were about to hop on this question too.
So Paige, you are right, like in the center of this lane. You definitely highlighted everything that I was going to talk about. Being a community-based organization, it is important that we maintain who we are in the NIH process. And having been in this game for a long time, I will tell you that there are some gives and takes when it comes to NIH funding, especially around incentivizing the community. Most partners, research partners, want to hand off a gift card, which because it's easier to do it that way. However, you have to learn how to put language in the proposal that will speak to the expertise that is in that community. People are willing to pay experts for their expertise. And so we have to learn how to partner with community agencies around their areas of expertise. I think that with NIH funding, because we have been on participatory projects for years, and I think Paige is correct in what she says is you have to leave that community agency or community better off than the way you found it. If not, you're doing a disservice to the community and that agency. So, we all pretty much know how universities roll. They have this huge overhead amount that they get, and yet the community agencies either don't know how to get those same indirects, or they struggle with that conversation. So it goes back again to what I said about transparency and being upfront and honest with each other. We already know that you get $1 million off top, but what's left is how are we going to distribute these funds equitably so that we're able to get the work done that you need to have done in the community, and you're able to get done what you need to get done at the university level. I feel like we have to be very fluid in our movement with universities around budgets, because budgets do change, budgets get cut. But does it always have to be the community agencies that get cut? Can the universities cut some of their staff or personnel? The community shouldn't always be at the brunt of the changes and the cuts that happen. So I just, hang on Paige's words that, the community organization is an organization where we also have needs, and we also have those costs that are directly associated with working with universities.
Thank you. Dr. Delgado-Rendon, would you like to describe a little more your experience using participatory budgeting in research?
Well, in specific partnerships, I've worked in several projects with faculty from different universities. I've actually had the pleasure of working from both sides. I was a manager at a community organization for 7 years, so I've been on the community side as well. And I'd like to say that, most of the time it's been a great experience. And I think when the faculty were trained by a mentor who understood this process, who understood the importance of the community in order to make actual change and to do good science, actually great science, and not just for science sake, but, well, I'm sorry, I don't know how to explain this, but I think to work with the community, it improves the science, if I may say.
Yeah.
And sometimes people, scientists, and I'm a scientist, and people who just went through the hard sciences, we just think of the laboratories at the university being science and being the correct science, when actually it is the real world, which is the real lab we should be working on. But I've had experience on several projects, and so when scientists came from this understanding of the importance of the community in research and to make change, I think the process went much better. I think some other people already mentioned that sometimes they say, well, I'm applying for this grant and I just need some participants and I'm going to give you some gift cards, if at all, sometimes not even gift cards. And so then we would have to think, okay, what is the long-term strategy for this? What is it? What's in it for us? And so it was kind of, somebody also posted a question in the chat, so I'll answer too,
Sure.
about training in participatory budgeting, because my bachelor's is in biochemistry, my master's is in epidemiology, and then my PhD in public health. I'm not bragging. I'm only explaining that I had no training in business. All my training has been in science, but when I was working at the community center, my boss, he had like 25, 30 years of experience in business management. And he walked me little by little. He mentored me in budgeting, in grant writing, in business, in managing staff. And I think that makes a big difference. So somebody mentioned, how do we get trained on that? I think we need to be interdisciplinary, not just scientists, but we also need to learn from people who have experience in business, in partnerships. So I was very lucky in that. I mean, by the end, I was writing my own proposals. I was doing my own budgeting in my Excel sheet, doing the, what do you call it? The benefits, fringe benefits, and, doing it all myself. But I never took a class on that, I learned, somebody taught me, and I also read. So I said, okay, I would buy books, about how to do that. And to me, I think participatory community work is more like riding a bike. You can't just read the manual and say, I know how to do it. You actually have to ride the bike to get experience. And again, it comes, I think, with mentorship. If you can work with somebody who is successful at this and who can show you the way, I think that's much better. So I hope that helps with information about the training. But I don't know if we'll have a little more time, but my other message is that when it comes to this budgeting, that it needs to, even though the projects may only be for 2 years or however long, and actually, right now, like $100,000 is not the same as it was 20 years ago with inflation. It only goes so far. So I do think the NIH and some other places, they need to adjust their funding to inflation, but because it cuts on the community side, usually cuts on the, like they were saying, it doesn't account for indirect cost. And sometimes it comes by reimbursement as well. So the community organizations, like right now, when I'm talking to some community organizations, they say, we will be reimbursed for the cost. And they say, we don't even have money to put up front in order to be reimbursed like 6 months later. So all that should be considered. But I want to say that when we were working, like again, with Dr. Wells and others, we tried to use the money for resources that would last longer than the project. Okay.
Yeah.
So whether it,
Sustainability. Mhm.
yes, whether it would be getting some updating the computer and the software system, getting new printers, so we could, after the project ended, we could continue to print materials, you know, for projects, for health projects. So I think that's another way, even when it's NIH, even when it's whatever grant funding it is, to think about what is going to be working, helping after this grant.
Yeah. Thank you.
I just want to, there was a few things that Angelica said that the point about inflation and how budgets change, and how with this participatory budgeting process that I mentioned at the beginning, that we're going through a renewal process, that our budget 3 years ago looks different than our budget now. Our infrastructure has changed. Our community, our communities and the ways that we're supporting them, those processes has changed as we've kind of, it's been a very emergent process. And I think that that's kind of a point of advocacy for researchers in terms of when a CBO changes some things in their budget that maybe weren't in the original budget 2 years ago, that you take the time to understand why, so you can advocate and get them to that point. So that was one part that where CCPH is actively going through right now, and I'm the person doing that. Another piece that I saw in the chat was around the conversations around university indirects and salaries. I think going back to Misha's original point is like, what is the agenda of each of the partners? And when it comes to budgeting, not to put a blanket statement over all institutional partners, but there is an agenda to make sure that the funding to support the institution, that there's the indirect that's negotiated, there's a certain amount of salaries that need to be covered by this particular project. And I think having transparency over that, saying, I really need to put this grad assistant in this project, I really need to have them funded here. Maybe this is the ways that we can collaborate, that they can support you, but making sure that in that support, they're not becoming a burden on the CBO. Like there's all sorts of, that's a conversation that needs to be had, rather than, we can't fund you for your position in your CBO, but we have somebody over here that will do that work for you. Like those are things that it's really about having those conversations. And I think for institutional partners, not only understanding what is my agenda as an institution-based person, how can I be honest and transparent about that? What are the things that I can reflect on of like, what do we really need? What is really important? To Dr. Delgado Rendon's point, like this partnership is going to impact the science in a lot of wonderful ways. And so how can we value that in the budget? And I guess the part after participatory budgeting is understanding the delivery of the funds. That is such, like, we get to a point where we have a really wonderful, equitable budget, but then my university is cost reimbursable only. So that's a lot of upfront for the community-based organization. Are there places that maybe we can advance funds? You know, if they're putting out community grants, we can advance those and set up some sort of situation where you're just understanding the burden of what it means to be a partner with institutions are high needs partners. Like there's a lot of paperwork, there's a lot of processes, there's a lot of infrastructure and hoops that communities are going through to be your partner. And so I think having an understanding of that, looking at what that process actually is, like that puts burden on the institutional partner to be right there with their community partner going through that process.
Thank you, Paige. So we have 3 minutes remaining. So I want to thank all of our amazing panelists today for your insights, sharing your experiences. We can get the slides back up. We do have an evaluation that we would like to get your feedback. We will put a link to that evaluation in the chat. And we would love to, again, get your feedback on this session today and hear about, what we can do better as we move forward with future sessions. Can we get that link in the chat for you all? Great. Okay, so you can click there. Please complete the evaluation. And I just want to remind you all in our next couple minutes that we do have future Lunch and Learn events, so please do save the date. Our next session will be July 12th on community-based participatory research, 12 p.m. Eastern. And we will have another session on culturally responsive dissemination on August 9th at 12 p.m. Eastern. And please also do connect with CCPH on social media, visit our website. We will be following up with a copy of the slides and also some resources that went into putting together this presentation so that you can dive in and learn even more about participatory budgeting. Again, I just want to say thank you to our fantastic audience who brought wonderful questions today and a lot of engagement, and to our fantastic panelists and our interpreters as well. Thank you so much. And yeah, just a reminder, please do complete that evaluation, and we will see you on July 12th, I hope.